Jax, a local pup diagnosed with cancer, now cancer-free because of a breakthrough cancer treatment. Now, this is Hank, a 6-year-old pit bull. He was diagnosed with a mast cell tumor on his front left leg. Now, Hank's owners, who are also his veterinarians, were able to save his life. Dr. Katie Green, veterinarian at Intracoastal West Veterinary Hospital. You are that veterinarian who is also Hank's wonderful owner. Good morning. Thank you for joining us.
Thanks for having us.
So something we were just talking about, Hank was only 6, is only 6 when he was diagnosed, which just feels so young.
Yeah, absolutely. I think some of it we don't really know, and some of it is genetics, I think, and some of it is owners are much more diligent, now than maybe 20, 50 years ago, and so we are catching these things and finding them, doing the treatments, and then they get to live a lot longer.
I know, which is what we all want for
Absolutely.
sure. So how first did you find out? I mean, obviously you're a veterinarian, but I'm sure there were telltale signs that something was wrong.
Yeah, so he just had a lump on his wrist. It didn't hurt him, it didn't bother him, but we know that anytime we have a lump or bump, we always want to get that checked out and tested, and so we did those tests and found it when it came back cancer. Yeah. And
then I just, for anyone at home who maybe has an animal, because again, 6 to me, I would never think cancer,
right.
Or because I have my dog's 4, and I'm like, oh, you've got a long way to go. What should you really be? What exactly does a lump look like?
Yeah, so any kind of abnormality on the skin, like when you're petting your pups, if there's any something that you've never felt before, like a little swelling, sometimes there's hair there, sometimes there's not. With Hank's, it was covered in fur, but it looked like he had sprained his wrist or something. In a human, you'd think that, because it was a little bit swollen. And we thought, well, maybe he hurt himself, but surely that's nothing to worry about. But it definitely was.
All right, so tell me about this treatment.
Yeah, so it's called Selfonta. It's so cool. Previously, for a tumor like Hank's, especially where it was, we would have been looking at either removing his leg or maybe a long course of radiation. But they've developed this injection. We injected it right into the site of the tumor, and then it rots the tumor from the inside out. It brings in all the good cells in the body to help break it down, and then it rots, it basically falls off and then heals just like a regular wound. It's incredible.
And it doesn't have a lot of negative side effects.
The first couple days are a little painful. We had him on quite a bit of pain medication, some CBD products, things to help just keep him more comfortable. He had a little bit of limping, but after about that 3rd day, he didn't have any issues. It looks really gross because it does kind of rot off, and that's probably the hardest part for owners, is just watching that. It was for us.
Yeah.
Vets were like, oh gosh, it's so gross. But after that, about 3rd day, he's been like nothing's happening. So.
I mean, you think about the alternative again.
Yes.
Potentially taking off the leg, or just radiation, which is in itself a huge deal.
It is, yeah. It's a lot. That's a lot of time, a lot of money. That's the other great thing. This treatment was a fraction of the cost of those other treatments. It was less than $1,000 to treat his cancer. Radiation's about $10,000. So
wow.
That makes it even more accessible for owners too, who maybe couldn't afford to do that treatment. Now they have options to really save their lives.
So how new is this treatment, and how do you know if your animal is a candidate?
Yeah, so it's been around, I think it's been about a year or so that it's been out in mainstream veterinarians. So it's a certain type of cancer, mast cell tumors, which are one of the more common skin tumors in dogs. And so your veterinarian will look, depends on the size and the location on the body, and if it's had any spread, whether or not you can use the Selfonta. But the sooner that you find it and the smaller it is, the easier it's going to be to treat, whichever the right treatment is.
This is without a doubt a game changer.
Yeah, absolutely. Oh, totally changed the game. I mean, he gets to keep that leg. He's happy, that's all we have to do for him now. It's almost healed. You can kind of see this is what's
that's
left
nothing.
of it. Yep, and so his tumor was kind of like this.
Oh my goodness.
So it's almost all done, and it's been a little over a month since we did the injection.
Yeah. Hank, you're doing great, buddy.
Yeah.
All right. right, so how do you ask your doctor for this if you know that your dog has potentially something wrong?
Yeah, so go in for, check the lumps. If it comes back a mast cell tumor, just ask them, is this a good candidate for Selfonta? And, I think most of us now have heard of it, gotten some training, so they'll help you out. Or they may send you over to like an oncology veterinarian, if it's not something that they provide. But
and look how good Hank is doing. All right, this is so cool. It's such a great treatment, it's such an option. Thank you so much for joining us this morning. Thank you, Hank, for joining us. Mel, I'm going to send it to you.
Right, such a cutie. Such a great story, too.